Thanks, ladies and gentlemen, for staying with us in Talking Points. We are receiving Charlotte Tcheudji. She is a hope bearer coming all the way from the United States of America. You're welcome.
Thank you. Thank you for having me.
Yeah, you're a hope bearer, and we're going to be talking about sickle cell, which is a serious health problem in our society today, sometimes attributed to witchcraft, attributed to some supernatural happenings and so on. And many people have practically become hopeless as far as this health problem is concerned. But you are a mother of 2 children who suffered, put it in the past tense, because now they have been cured, suffered from a sickle cell. Can we share your experience? Can we share your story?
Okay, my story is this. I had 2 kids with sickle cell, and one had a bone marrow transplant. It's been 9 years, and the second one just had a bone marrow transplant. It's been 8 months. So having those kids, I know what parents are going through, because I was in their shoes and I know the pain that they are going through. So having those kids is very hard on parents mostly, and financially, and health issues. So they hope that...
What are some of the challenges that parents who have children suffering from sickle cell go through?
Okay, the challenges with kids with sickle cell, they go through a lot of pain, bone pains and joint pains, and they are mostly in the hospital all the time because of this disease. And most of the parents does not know how to handle this situation. Most of the time they think that is witchcraft. It's just something that happened. It's just a bad luck, but it's not a bad luck. It's a disease that is through it's a genetic.
It's mainly hereditary.
Yeah, it's hereditary and it's genetic. It comes from dad and mom. That usually they are AS, and they are both are AS. So you can have kid with AS or AA or SS, and when it happens. Usually we have to cancel couple before they get married.
All right, we're going to be coming to that shortly.
Okay.
That is talking about prevention,
yes.
How to prevent that. But first, tell us, how did you manage to handle your children right up to the stage where they are today?
Okay, the management was just every time
taking care of them.
Make sure that they drink a lot of water, good feeding, good food to nourish them, because usually they need a lot of vegetable, a lot of water, because with the water it flushes their system, because that's what is the problem with those kids. So make sure that they eat well and good food, and make sure that when they are sick, the next thing is just to take them to the hospital, and so that they can have the treatment that they deserve.
All right, now let's talk about how they were cured. You were talking about bone marrow transplant some few seconds ago.
Yeah, so they were cured. What happened with bone marrow transplant is not like a medication that you take and you get healed. It's a bone marrow transplant, and because before having the bone marrow transplant, you have to get one of the siblings, which need to be compatible to be able to give to the siblings that is a sickle cell patient. But I have one of the siblings was the donor, but this last one didn't have a donor in the family, so fortunately we had a donor from Brazil that came and just give the bone marrow to the patient, and after the bone marrow he left. So we were just fortunate to be in that situation.
All right, so but that should be quite expensive. I talked with a medical doctor who told me that that is not yet practiced in Cameroon. That should be quite expensive. Yeah,
it's really expensive over there, but most of the time kids that lives in America have insurance, which the insurance cover. But I'm working with another association here that have the possibility to go to India to have to receive that same treatment, because we have many cases that they are coming, and our goal is to register those kids with sickle cell, and parents that can afford the medical bill, and in India we can make sure that they go there and receive the cure if they can afford the expenditure over there.
I believe from what you're saying, you're rekindling hope in some parents who are listening to us now and who may have children suffering from sickle cell. But what is expected of them if they really have to benefit from your help so that they can get cured in India or in the United States, as you indicated? What is expected of them? How should they go about meeting you and so on? Okay,
I have some website and some phone number. The website is sicklecellcameroon.org, www.sicklecellcameroon.org, that they can go through. And I have some phone number that I can give to them. Is to contact us is 677-88-1045.
What is expected of them?
They expect
finance and
the finance when our foundation, because I have already a foundation in US and I have another one. I'm working with one so that we can be able to help those kids. The expectation is like $17 million just when we refer you, and we can go in more details when you contact us. We are not taking any money. We just refer you to that hospital in India that has been able to help those kids that the parents are more wealthy.
There is hope.
Yes, there is hope.
Now, prevention. It is often said prevention is better than cure.
Yeah.
What are couples, what are individuals who will be getting married tomorrow? What are they expected to do to prevent having children with sickle cell?
Oh, I encourage all the couples that wanted to get married to make sure that they get their tests done, electrophoresis, so that they won't be in this situation, because we can avoid it. Because when you love once, you can love 100 times. So instead seeing your kid suffering, I advise, and most of the time I prefer in the hospital that when the child is born, they can screen the child to see if it's a sickle cell, so that they can start a treatment for those kids, instead waiting, and after 5 years, after 3 years, they realize that it's a sickle cell. So I will encourage all the young couples that they are getting married to get the test, electrophoresis, to make sure that they know what group they are, because you can be AA, AS, or SS to avoid this situation.
And this is a serious concern, because many people do not even know about the test. Yeah. Some know about this, but they don't care about going for it, except in some religious or Christian denominations, like the Apostolic Church, that I know very well, where it is one of the prerequisites to get married. When you want to get married, the marriage committee will tell you you must go for this test and bring the results for us to know. So could you emphasize more on the importance of this, so that those who don't know, or those who are hearing about it for the first time, can really weigh the importance?
What I would really encourage people to do, because it's not just it that is a problem. Because when you are getting married, you always ask your partner, can we go and make sure that each other are seropositive or HIV? That's the same thing you have to do to avoid those kids with sickle cell. Because the community need to encourage that test to be done before you get married, to avoid the situation that a lot of parents are living into. Because that's that sometimes they don't know. But I encourage every couple to make sure that they do the test. As they do the HIV test, just to do electrophoresis to make sure that they are compatible to get married.
And when they discover that they're not compatible, the marriage is cancelled?
I will really emphasize that and encourage couple that if we realize that you are AS, I'm AS, I will say, that's what I say, you love one time, you can love many times. Instead seeing your kids suffering because it's so painful for mom and dad that those kids are going through.
All right, the last word before we go?
Okay, the last word is just encourage parents. And right now I have clinic that I'm working with. That's why I would like everybody to have this number in case you have any problem. We are there to help. We are doing awareness. We are doing counseling before getting married. We are doing a lot. We help a lot of people to go through, those who are worthy, to go through Indian. We have all the information that they need so that they can help their kid. And I encourage parents with sickle cell to be strong and love those kids, because most of the time they are abandoned because they tell them after 20 years you are gonna die. It's not true.
And it's
just
not
give
automatically witchcraft.
It's just witchcraft.
It's not automatically
no, it's not. It's not. So I encourage parents. I've been in their shoes. I know what they are going through. I'm giving them courage to keep going. One day we're gonna find a cure, and they're gonna be a happy parent like I am today.
Thanks a lot, Charlotte Tcheudji, and our condolences. You lost your mom.
Thank you. I lost my mom. I just came back from the bury, and she's really happy where she is, and that's just the life that you go. It's a lucky to bury your parents. So I was so grateful towards that situation that God have chosen that, and I'm so happy to be able to bury my mom.
All right, thanks so much for coming. Safe journey back to the US. Thanks, ladies and gentlemen, for staying with us. That's it for today.